So we've talked so often about our healthcare system here. We know about the situation in Quebec where so many people, what is it, almost 2 million people here still with no access to a family physician. Well, that's in Quebec. Now there is a study, Toronto-based research team meeting with about 10,000 Canadians to talk about the healthcare system. And I think it's fair to say, and our guest who is part of this will tell us, but I just, as I look at the results here and I think to myself, okay, we tend to look at ourselves, living in a vacuum in Quebec. It's bad everywhere. I hate to say it that way, but that seems to be what this number says. 10,000 Canadians who basically say they're a little frustrated. In some cases, perhaps more with the access to a GP than the healthcare system in general, but let's find out. So first of all, let's go to the phone. Dr. Tara Kiran is a family doctor and scientist with the MAP Center for Urban Health Solutions at Toronto St. Michael's Hospital. Thanks so much for being with us.
Thanks for having me.
Look, 10,000 people is a lot of people when you do a survey across this country. So first of all, your reaction to what you did find out.
Yeah, we know so far too many people don't have access to primary care or family doctor, the front door really to our healthcare system. We had a survey done as well as had conversations from folks, and what we heard is that through our survey was that more than 1 in 5 adults didn't have access to primary care. That translated to more than 6.5 million people in Canada. And that means that they have nowhere to turn if they have a new issue, if they have a chronic condition that needs to be managed to get kind of preventive care like immunizations. That kind of lack of care actually has real consequences for folks.
Okay, so when you talk, first of all, can you tell us about the panel? Because I understand you had a variety of community roundtables here. How long did it take to get these results? How did it work?
Yeah, so over 16 months, we heard from more than 10,000 people. First, we did a national survey back in fall of 2022, and then we did a series of priority panels, including one in Quebec, but also in Nova Scotia, Ontario, Manitoba, and BC. So basically, these brought together about 35 randomly selected volunteers from the province who roughly represented the demographics, but they were all strangers to each other, and they actually spent about 30 to 40 hours learning about primary care from experts and then meeting together to decide on coming to consensus on what are the key issues, what the recommendation should be. And then after that, we actually had 10 community roundtables in the same 5 provinces. And these were really focused on underserved communities that we know often struggle to have care, including Indigenous people, people who are newcomers, members of the Black community. And so those were one-day sessions that we had that really helped to amplify those voices.
Yeah, it's sad to read, a comment that you made in the story in the paper that you say we're a country of have and have-nots. And, when you're dealing, I mentioned off the top about 2 million people in this province alone having trouble getting a GP. Fair to say that that's the case, but the question then is, how do you level that playing field?
Yeah, it's a great point. And, what we heard from people across the country is that access to care was a key value, accessibility. That meant that they wanted everyone in Canada to have a family doctor. They recommended that one way to do that was to actually expand team-based care so that people could actually family doctors could look after more people, provide more holistic care. And also they heard that that's a potential antidote to burnout. That's actually, we know burnout is a cause for people leaving the profession,
right.
and team-based care is one of the anecdotes. They had other recommendations too, like integrating foreign trained professionals more quickly. So that would allow us to have more professionals to be able to provide care, but it also actually would increase the diversity of the kinds of people that are providing care, so making it more safe and more language accessible for many people. Another key recommendation was actually for everyone to have access to their health records. Right now there's so much wasted time and frustration, and honestly, it impacts patient safety because people don't have access to their records. They're seeing different people who can't see what happened before. They move provinces, they even move cities. They can't take their information with them, and it just causes duplication and frustration. And that time and effort could be better spent.
Key word, frustration and dissatisfaction, I guess, are both applicable. I wonder, too, at the end of something like this, when we talk about, health problems or access to private or to public care here, Money is always an issue, but, we also know that just throwing money at something doesn't necessarily fix the problem. So what is the solution here? If we know that these are the issues we're dealing with, is there a solution that we can simply say, you mentioned a couple just now, but I'm thinking on a national level, do we need to do something different?
Yeah, so I do actually think we need to spend more money, but spending more money will actually get us a healthier population and actually lead to cost savings in the future. And ultimately, that's what our money is there for, is to support each other to live long and fulfilling lives. We know that health systems that have strong primary care have better outcomes for everyone and lower costs. And we know there are many European countries where 95% or more of the population does have primary care. And, one of the differences is in some of those European countries, they actually spend more of their total health budget in the public system than we do here in Canada. And they spend more of their total health budget on primary care. So one of the other things that our panelists recommended is let's move upstream. Let's actually try and prevent the problems before they happen by spending the money on primary care and preventive health.
You mentioned, I think, earlier in the interview, this idea about, qualifying more foreign doctors who come here, and many of them are qualified or overqualified and don't seem to end up in the system. And I know every province is different. How significant, I guess, is that?
I think that is a strategy that can really have a significant impact. I think there are a few different pools of doctors that are foreign trained. So there are foreign trained professionals who've immigrated they've trained in other countries, they were born in other countries, and they've moved to Canada and want to integrate but can't. But then there are actually also people who grew up in Canada who are Canadian citizens. They didn't get a place in medical school, so they went abroad, they studied, got a medical degree, but can't integrate back. And so I think when you look at both of those pools, that's a significant number of potential, not just doctors, but nurses and other health professionals.
Yeah, and I wonder, again, because, we have that split between what the federal government can do and what provincial governments want to do. And here in Quebec, of course, typically this government will say, we can handle our own healthcare system, just give us the money to do what we have to do. But is that something you think a federal government could actually pass in terms of legislation, or at least suggest to provinces that they consider doing something like that and taking all these doctors who are coming here or coming back from having studied abroad and putting them into the system?
I do think that the federal government has a role in working with provinces, and I've seen in the recent bilateral agreement in some of the provinces there are specific lines about trying to accelerate the integration of foreign trained professionals. There's other roles that the federal government can play too. For example, putting forward legislation that'll makes it that every electronic medical record company allows patients to be able to access their own record. And then, of course, there's a huge role for provincial governments to play as well. I think one thing that I would urge both federal and provincial governments, though, to do is to be ambitious. So, we don't want to go from 77% to 80% when it comes to people having a family doctor. We want to go to 100%. And when you think about 100% and how you have to design a system for everyone to have care, you actually have to think differently. It's not just putting little bits of money and doing the same thing, but a little bit more of it. You actually have to redesign the system.
Yeah, in and of itself, as you say that, I think what a massive job that is, but obviously it needs to get done. This survey gives us an impression that so many Canadians, as you said it originally, are either frustrated or dissatisfied with access to care. I want to ask one last thing, and I'm not sure if this is something you covered. This is an issue here, the whole idea of private medicine or private health care. Did that come up at all in your surveys?
Yeah, so we did do a priority panel in Quebec where public members were asked to deliberate about the role of private care. I will say a few things that happen. We heard it both in Quebec and elsewhere. One is actually, if anything, people actually wanted expansion of what was covered under the Medicare. They wanted to have it not just be doctors and hospitals, but also medications, so pharmacare, as well as dental care and mental health care. And, they did want to actually have more rules in place around the private system. They felt that it was really important that every person in Quebec be able to have publicly funded primary care, that the people shouldn't be forced to turn to the private system because they can't access care in the public system. And they had some other specific recommendations that are available on our website, ourcare.ca, and you can check out the reports from Quebec.
Okay. I thank you so much for your time and for the information. Ourcare.ca if you want to get more information. Dr. Kiran, thanks so much.
Thank you.